Welcome, everyone. You are attending a wonderful virtual recorded panel today called Catalyst of Change, Digital Health Solutions Driving Latina and Latino Community Wellness. This is part of the Rock Health Summit virtual series, and I'm really excited today to introduce you guys to a group of amazing leaders who are doing work themselves to focus on what we can do through digital health to engage our communities, and also what there is that is left to do. As we all know, the Latina population in the US is the fastest growing demographic in the country, and the digital health innovators are striving to meet this population's scaling needs. We are focused today on not only the solutions available to meet those challenges, but the work that is left to be done. For those that know me, my true north is always to focus on impact. So hoping we can share best practices of what's working now to improve our physical and mental health needs of our comunidad, and also what is work that is left to do. So let's get going with introductions and give you a glimpse about who we are and why we do this work. So I'm asking Felix, Lilia, Roberto today to introduce themselves and give us a one line about the work they do today. I'm happy to kick us off. I'm Vanessa Villaverde. I'm the daughter of an engineer who grew up imagining tech was the great equalizer and that education would give us access to all. I do this work and I'm currently the investor for California Healthcare Foundation because tech alone can't do it all. And in the 42 years that I've lived in the United States, I realized that personalization and design for solutions into our community need to come from those with lived experience from our community. So I'm excited to introduce Felix next to talk about himself.
Hi, everyone. So I'm Dr. Félix Chinea. My pronouns are he, him, él, depending on the language that you're speaking. I am a Puerto Rican military brat who grew up mostly in the Southeast, mostly in Georgia and North Carolina. I am the Director of Health Equity and Inclusion Strategy at Doximity. I am also a co-founder of Colectivo Health in collaboration with my partners, Ivelisa Andino and Carlos Rodarte. What brings me into this work is honestly the experience of my family navigating the healthcare system. My abuelo, who navigated the healthcare system with a chronic disease, specifically with diabetes for decades, and suffered from complications resulting from diabetes. And that brought me into healthcare generally. Thought I wanted to be a physician, practicing clinician, academic clinician researcher, and found myself wanting to be in a faster pace, more innovative environment that was also data backed, and made my way to health tech from there, and haven't looked back. And I'm very happy to be in this space and focusing on health equity and thinking about how we can design products more equitably for the Latina community and for other historically marginalized communities as well.
And I'll go next. Yeah, definitely. It's so great to be here. Excited for this conversation, timely and super critical. My name is Lili Gangas. I'm the Chief Technology Community Officer at the Caper Foundation, which is a private foundation working at the intersection of racial justice and technology. And we do our work from an ecosystem perspective. And I think having this conversation from an ecosystem, cross-sector, different lived journeys is really critical. I also the co-founder for LTX Connect, which has been one of my projects specifically to center on the Latine experience across the U.S. and all these different identities we carry. And both of these roles come informed from my own lived journey as being an immigrant from Bolivia, being proud of my indigenous roots, but also having to adapt right to the life here in the United States. And being able to see my mom, who is really my North Star in all of these conversations, especially about health, seeing somebody like her, unfortunately, as we see the challenges that we face in work and stress and managing, sometimes being the single parent, et cetera, and just seeing my mom's own health and seeing her deal with diabetes has been something that has always helped me understand the importance of health, not just physically, but mental, emotionally, as they all come together. And one of the things that I'm excited to discuss more today is also the power of technology, right? To even look at how to address some of this. So I'm looking forward to, how science is actually helping my mom now. And, when we bring in the digital equity perspective, if it's done right, it could actually have really positive outcomes. So looking forward to sharing those opportunities, as well as sharing, the real challenges that we have from a systems level perspective as well.
Roberto?
Thank you. It's a pleasure to be here. I'm humbled to be joined by, three of my heroes in digital health innovation and innovation at large. The founder and general partner of Sequential Ventures. We're an early stage, pre-seed and seed stage investor at the intersection of social determinants of health and technology. We primarily back folks who have lived experiences in the markets and the problems they're trying to solve. That comes from my personal passion of trying to make a difference in healthcare. I began my life as the youngest of seven in Tecate, Mexico. Shifted to an undocumented immigrant here in the U.S. and as someone that has persevered through those challenges, definitely has seen a lot of challenges accessing the right care at the right time. So three reasons why I'm in it: my personal journey with my own health, my mom's journey as a caregiver, a drastically underpaid caregiver who at 67 years old still works way more than she should be, and also my siblings and my near-term family who are still themselves on Medicaid, Medi-Cal, and have a lot of the access issues and engagement issues that we're going to be talking about today. And so privileged to be joining this conversation, and thanks so much for giving us this platform to the Rock Health team.
Great. Well, let's get right into it. You all brought up your families. I think that we carry our families with us everywhere we go, certainly in our community and certainly in the work that we do. The Latinx population is projected to grow by 77% to 111.2 million by 2060. And yet, we continue to hear stories from our own community, from our own families, about those that are not gaining access to quality physical and mental health. Specifically, health disparities cost the U.S. economy $451 billion, and per HHS, the Latinx demographic accounts for 21% of that, or $94 billion in losses, because there is a mismatch or an unmet need. 6 in 10 Latinos report having difficult time communicating with their healthcare providers because of language and cultural barriers in the system. So I want to start on this question, because we are each of us looking to actively solve for this connection point to reduce the amount of loss in the system and the loss in our communities. Where are you seeing engagement working? Where do you see that innovators are gaining traction through digital health? And who are the innovators that you may be funding or supporting that are scaling solutions now? Lili, I'll start with you.
Yeah, I'll definitely start. I think we always think as innovators, maybe perhaps being the venture-backed type of innovators, but what I think it's, to me, the just reflecting of the time coming out of since the pandemic, right? The innovator has been the federal government, looking at the state levels, looking at the amount of funding that's been allocated. Specifically, when we think about, where we saw in the midst of the pandemic, if you didn't have a connectivity and access to internet and digital literacy, you couldn't go to school. You couldn't get doctor, you couldn't get healthcare services without risking your life to some degree. You couldn't really work. And the ones that did work were disproportionately people of color, specifically Latine, and if we think about California. And I start there because I do think that we're really at this point of moment where in one side here in 2024, everyone's so excited about AI and there's so much stuff, and we'll talk about that. But at the same time, there's still all this foundational infrastructure that needs to be invested in, developed, so then that way we can leverage all the opportunities and innovations, right, that can come out specifically in the digital health sector. But if we think about, the funding that went towards the $65 billion that went towards digital inclusion, there's new grants coming out to specifically look at digital state plans. These are infrastructure investments that we need to make sure that we're advocating for at our community level, specifically all these different zip codes where the majority of the population may identify as Latine. And the reason I bring this up is because when, as I shared, right, when I started my introduction, sharing about my mom and her struggle with diabetes, but being able to also see her journey into being able to adapt the apps, especially during the pandemic, to be able to have that type of opportunity to see her doctors and have those conversations wouldn't be possible if we didn't have this level of digital inclusion. Specifically for the Latine, as you shared earlier, some of those stats, we're also some of the folks who have some of the highest probability for diabetes-related complications in general that can affect in a lot of different ways. And I think this, to me, I start here because we want to make sure that as we're continuously investing in digital equity and technologies, that we're not forgetting the foundationals and the importance of digital literacy. And this is where being able to have the trusted messengers, to be able to have the multi-language, to have the cultural opportunities. I think that's the opportunity for investors. And I would say, as from a K Percenter perspective, when we did our Latina Tech Ecosystem report earlier this year, we're still, lagging behind as the folks who are creating the technologies, who are designing, as well as owning and investing. So I do think that there's a huge gap that we have to make sure we're closing, both not just on who's getting the funding, but also the education, the opportunity, and that really depends on the infrastructure that we have. And so I think as funders, we should be looking at those foundational infrastructures, the education, the programs, but also the policy that can help inform the mega size investments that we really need to meet this moment, especially with the backdrop of the AI hype that is, has taken over a lot of the different investments.
Thank you. What about you, Felix?
Yeah, I was going to chime in there. I think I want to validate both of the things that you both said into this, which is that the fact that there's an unmet need and opportunity here to do better around digital health solutions and building digital health solutions that better engage with the Latina community. And I want to really harp on the fact that we already know that a large majority of our community is using these digital health solutions already. People are engaging with digital health, and there's an eagerness and an appetite to use digital health solutions. It was in the Rock Health's 2023 Digital Health Consumer Adoption Report that showed that about 80% of Latina respondents receive virtual care at some point. And that same point is validated by Doximity's 2022 telemedicine report that showed that 73% of Latina patients plan to receive telemedicine care after the pandemic. And this was pretty comparable to all other racial ethnic groups as well. So clearly there's an appetite and an eagerness here to really engage with digital health solutions. The question is are we building and offering the types of solutions that are really culturally responsive and culturally connective to folks that's really going to have that stickiness to keep them there? Because a lot of the things that we're talking about here is the inequities that we're seeing around chronic diseases, especially with diabetes care. And we already know that no matter whatever chronic disease treatment plan that you give out there, it is not going to be successful without patient engagement. So as we think about these types of solutions and the type of engagement and stickiness that we have and how much it connects with the community, that has real downstream effects as to what does their care look like, what does outcomes look like. And I'm seeing this even with my own abuelo. He lost his eyesight due to diabetic retinopathy. He is still sending me text messages through his iPhone. He is navigating, technology in a much better way than he did, before he lost his eyesight. And so our even older populations within our community have the ability to navigate these tech products, especially as they're getting to be more simple in the way and more human-centered in the way that they're designed. So I think that's the direction that we need to see technology go in, and I think that's the direction that's going to serve our community in a better way.
And I couldn't agree more with that, Felix, and you too, Lili. When I think about the areas of opportunity, I reflect on the fact that more than 58% of Latinos do have access to a wearable device. I think there's this misconception that we are sometimes not a tech-forward community, that we're a Spanish-first community. And really why I try to identify founders who come from diverse backgrounds is not because I'm trying to promote diversity for diversity's sake. I deeply believe that they're going to have those insights from that lived experience that allows them to build with the right customer in mind, right? That works backwards from who the Latino community really is. How do they truly engage with their care? How do they make decisions? Who makes those decisions? You're bringing that wealth of experience to the innovation table and building the product around that. I think that's why it's so vital to have multiple perspectives at the table, especially those that come from a lived experience. Doesn't need to be the CEO, doesn't need to be the founder, right? We need to have folks around the table though that can influence those decisions. And echoing on what Lili shared is that it's an issue across the entire funnel, right? We need more funders in the space that come from that empathetic viewpoint, that understand the customer. We need more LPs that are willing to take bets on some of those innovators who may not have the exact resume that they're used to funding. Because the reality is we have proven our abilities sometimes through other means, right? I know everybody here on this call has, has an amazing background, amazing resume, and I would put my money behind any of y'all. But in general, we have a harder time getting people over the line, I think, to truly trust us as fiduciaries with their dollars when it comes to the funders, right? So it's an issue across the entire stack, in my opinion. But I think we're beginning to see a little bit more traction by some of these early companies, which makes it really exciting because now we can point to some very tangible results as to why we need to continue to do this work.
And I just want to give a shout out to those ancillary companies that are helping digital health. Specifically, I know in LA, there's work going on for digital health equity ambassadors. These are pre-med students who are working in tandem with clinicians where there have been investments into portals and wearables. But frankly, they need somebody to walk our abuelo through how to leverage these when they go home after their stroke, after their kidney removal, so that they can access continued ongoing technology. So shout out to Dr. Jamie Fernandez at UCLA for really spearheading at the Harbor Medical Center for spearheading what this looks like. And I'm hopeful that these ancillary supports will continue to wrap around digital health solutions. So moving right into population impact, per Kaiser Family Foundation, only 50% of the Latine population has private insurance. 36% are covered by Medicaid nationally. Thankfully, I live in California where Medi-Cal covers the undocumented and the numbers are not as dire. Yet, Latinx populations are less likely than other Americans to have health insurance and receive preventative care. From that perspective, where is the opportunity for digital health innovation to serve or to have an outsized impact in our communities?
If I may start, I think there's a huge opportunity on educating the customer, on changing the consumer mindset, on how health, how using digital health can actually help your overall health outcomes. I think when I bring up an idea to my mom, I'm often met with "Mijo, ¿qué es eso?" Like, I don't get it. Why would I ever use this? And I think spending that bit of time just educating her on why how you eat might influence, your overall health, and why maybe a company that's sending you text reminders on a frequent cadence, allowing you to engage with your own nutrition, why that might actually help you, right? I think it just takes a little bit of work with our families, educating the customer. I think one thing, and Vanessa, I appreciate your shout out to the folks that are doing work, very visible work out and leveraging their brand, their social media awareness to really educate the customer. I think about, for example, the guys at Fusen Medicine, when I see them post educational content behind how, the ties between, diet and diabetes, for example, and you look at the comments and you see all of these Latinos from all ages asking them to share more of this information. I think I've seen the hunger from the community to want to learn more, but I think that's where we start, educating folks and making all this information a lot more accessible. That doesn't always mean just in Spanish. It just means coming from a voice that we truly trust, because at the end of the day, we're a trust-based, I think community in general. I think whether you're Latino, Ecuadorian, Dominican, Puerto Rican, I think that's something that really binds us, is our sense of community and that sense of trust of the ones that are around us, right? And so leveraging that community to better educate folks, I think is somewhere where we can really lean into.
Plus one on the trust. I think just thinking about, and reflecting again, it's been 4 years since the pandemic. I don't think we've decompressed really, and we just kind of went from one thing to the other thing, and so have kind of normalized that type of stress on our communities and just continued level. That I do think it's important for us to take a time, especially when we're looking at the community, as Roberto mentioned, in different mediums, right? Meeting the community where they're at, and especially in this age where a lot of the mis and disinformation is happening within our own families, right? It's happening within the WhatsApp channels. Like, they send you like, oh, like, this is the what we're doing in Latin America, use it here or over there. Like, and it's all this type of, like, even within some of the families, right? The levels of mis and disinfo that sometimes they might not be aware, but they're just sharing things that, especially on the health perspective, that can have consequences. So I think being able to go back to the foundationals as well, being able to say, like, look, here are the specific, real resources that are vetted, and this is for, I think, like Dr. Chinea, like those types of voices are important, and I actually do think that this is an opportunity for our community, all the folks who have been in the front lines to really be able to show like, wow, there's so much, especially looking in California, the majority, there's a big gap in the talent specifically to be able to address the community in this way. So there's a lot of jobs and opportunities, and there's a lot of people on foot that I think for those who may not necessarily be thinking of like, well, I just want to invest in everyone. Well, everyone, there's a majority of needs that are coming up that are more nuanced, and that's an opportunity from both investment as well as from being able to help deliver the right resources that is important. Because as we learned from the pandemic and COVID, it's in everyone's interest that we're all healthy, because when we're not, we saw how the world literally shut down. So whether you're a business, a big company, an investor, it's in your best interest to make sure that all the communities are healthy. Otherwise, we have other consequences that end up being more costly. And I think one of the parts just to highlight here is, as we're seeing, especially coming out of the pandemic, 2020, 2021, there was a spike in investments in digital products. And then now it looks like it's starting to decrease, but it's really getting back to a normalization to some degree of pre-levels. But I would just, put that into the fire here of saying like, look, we don't let those numbers also decide like, oh, digital health is not as innovative anymore. We passed our wave, or it's like getting dried up. I think this is a time to push actually even further and leveraging the different types of innovators that have been, with those lived journeys, like now with the types of technologies are available that are lower cost, to make sure that we are supporting them. But I would just say that going back to the trusted messengers, both in person and ideal, but it's also looking at the data privacy. So I do think that there's a critical time right now to help inform policy and advocacy and transparency. So then that way we are able to leverage these immense, tools to do good and have them be able to also deliver on the promises that we're all having without, taking away a lot of the privacy, especially around health, that could otherwise be weaponized if we're not being cautious or aware or doing it responsibly. I'll pass it over to Dr. Chinea.
Thanks, Lili. Yeah, so I completely agree with both what Lili and Roberto said. The thing that's really like sticking out to me from what both of you shared is this like need for better communication with the community. And I think that's worth like really sitting with, because as we look at the community, there's a $3.2 trillion spending power within the Latina community, right? Like there's a lot of money to be had here to really utilize that is willing to be spent on good solutions across the board, across industries. I think McKinsey found that there was like $159 billion in unsatisfied demand among the Latina community for folks that are willing to spend more money on solutions that better serve their needs. So there's clearly an opportunity to better serve the community, and folks are willing to spend more money in solutions that actually better fit their needs. And then back to the point around that folks are using digital health products, we're seeing that the Latina community is outpacing white patients around using wearable technology, wearable devices, around tracking their weight digitally as well. So again, clear appetite to use digital health products. And then on top of like, as we think about like communication with that sort of spending power in that community, we talked about this earlier. It's not just translating solutions into Spanish. We have 71% of US Latina adults that speak English proficiently. And then we have about 85% of US born Latinas that actually speak predominantly English, like in their home. So that 71% is going to be growing. So more and more folks in our community, a larger majority, are going to be speaking mostly English. So what does that mean in terms of having solutions that actually culturally connect with us? We need culturally relevant and responsive solutions. And when I think about that, I think about companies like Zocalo Health that do a great job in terms of their marketing and their communications that is mostly in English, but they also translate as well, but mostly in English, but they do it in a way that's culturally connecting with the community, that can easily have that one-liner that makes it clear to Roberto, to your mother around like, why is this relevant for me? Why is it important for me to think about my diet, and how does it actually impact my day to day? And in a way where we're talking about the types of foods we actually eat, because oftentimes we're not seeing, the types of foods that we actually have at our table discussed when we're talking about diet and diabetes prevention. So like I said at the beginning, like no chronic disease treatment plan is going to work unless we get people to be bought into that. And I think communication is key to that. So how are these digital health solutions actually doing a better job to connect with our community in that way?
Mm-hmm. Oh, you bring up such great points, and since you honed in on Zocalo, I'm gonna jump onto that. Having transitioned from being an operator in digital health startups to an investor in digital health startups, I oftentimes see the miss or the differing points of view of what is valuable. And so, as we think about what works in the Latine population in terms of a community go to market, that is oftentimes mistranslated to investors who don't see the scalability aspect of a single payer focus. For instance, Zocalo has these amazing cafecitos, and they bring together seniors who may or may not have Medicare Advantage, who may or may not have insurance. They also bring their children who come to these cafecitos, typically the people who are traveling with their grandparents because we live in community households. These are people who may or may not be on Medi-Cal, who may or may not be paying into the cafecitos that Zocalo is giving. And yet, the wellness and the benefit, there's a tailwind across all payer lines. And so from a design perspective, I feel like those in the digital health world that are making the most population health impact may not be getting recognized for their community go-to-market strategies and the importance of that portion in our community. Special shout out to Sanadai, has one of the best mental health podcasts out there in the market, frankly, targeting every issue that we face in the Latinx population, from new motherhood to new immigration to taking care of our parents. Another shout out to Milagros Medical, who has a brick and mortar and a naturopath program as well as digital health. They are essentially serving everybody however they want their needs met. I feel like in our community, the stars are really going after the whole family's wellness, and I'm really thankful for that. So as we move right into responsible design or to digital health design, where do you see the gaps in translation around how our communities need to access care and the design solutions that are out in the market?
Definitely. I can jump in and then I'll let the gentlemen close it out here since they have also a much more nuanced perspective on it. But from a high level perspective, I think especially when we are looking at responsible design and of course this is where a lot of the conversations around AI has been going, right? So it's like, as I shared earlier, as digital health per se investments have gone down, anything with AI enabled has gone up. And I think one of the big moonshots is healthcare and AI, and specifically, how does this impact the Latina community? We actually, for LTX Connect, we actually hosted a webinar just on this topic with Colectivo Health as a co-partner and different entrepreneurs as well that are working at the cutting edges. And one of the things that I think what you all just shared here is like, number one, we want to make sure that we have the voices that are building, that have lived experience, that are also being able to help debunk a lot of these myths, right? And so what you shared earlier, that we're not a monolith. There is so many different complexities, but that complexity of our community and diversity can also help us break out some of those real innovations, those use cases that can be, where a lot of these new opportunities can be unlocked, but it also can help create solutions that work for all if we start with an inclusive design approach, especially when we're talking about the levels of all these different LLMs and all the types of data. But the problem is if it's biased data in, if it's biased data out. So what's the opportunity there to even look at the way our processes are from the first survey that a patient may fill out to, once they have this medical record throughout their life, what are some of the ways that we could also help to identify those opportunities to more proactively address those biases that can, as more and more AI gets leveraged in these healthcares at different areas, that we're not also, either unintentionally leveraging it to actually cause more harm. And so I do think that this is a really critical, especially healthcare and AI. It's a really important opportunity for the Latina community to partake in the design, the policy, the applications. And it's not just for technologists, it's really like the folks who are on the ground, as we've been all been sharing. And I do think also, one of the other topics is like, can we take a look at, how some of the research has been done? And this kind of goes back to my first point around what is the opportunity to leverage the government and some of these large R&D opportunities with investment that we haven't seen before, to really look at how are we also helping modify or update some of these research practices that may have become updated, right? Maybe they were done for a specific set of groups and profiles that now it's not reflective of what their needs are. So how can we also help advocate for updates and changes there? And I think the other part too, and I'll close with this on the cultural translation. I want to make sure that we also are not always thinking like, okay, we're design it and then let's translate it into Spanish, because you lose the whole flavor of when you do it that way. It's like if we started from a place where we're centering on these key cultural moments, cultural needs, eventually the experience is so much better from the way you inform the user, the UI UX design. Maybe it can provide new opportunities for collaboration between small and bigger sized companies or public and private sectors. So I do think that especially in the healthcare industry right now, it's going to change. It's like education. It's one of those things that have been designed for so many previous generations that it's the time for what do we want it to be for the next 100 years or the next generations as well.
I think I do need to, put my capitalist hat on for a little bit. And at the end of the day, when I think about where Sequential is trying to make a difference is definitely getting more diverse folks funded at the early stages that can bring those lived experiences to these different solutions. But at the same time, we need to make sure that these are, if they're going to go the venture-backed route, that these are self-sustaining operations that can scale and meet the kind of results that their investors expect them to reach, right? And at the end of the day, I feel like companies that are going to be most successful are those that follow the dollars and follow the data. And if you're engaging the community, if you know your customer, if you're leading from that angle, like you explained, Lili, it's so much easier to now be a better partner to your health systems, to your payers, to deliver on that data and allow them to get to that customer that is so hard to reach for them sometimes, right? They have all the data in the world already, they know who they need to identify, but they don't know how to get out in the community sometimes and truly move the needle on engagement. And so that's where I see the opportunity, is leveraging the technology to really complement the data and allow folks to create a more sustainable model, because we've got 94 billion in leakage costs, as you explained, Vanessa, but that's only going to grow as the Latino population grows. And if we don't become more engaged, I don't see how we close that gap, right? It's only going to grow. And that's why I think it's critically important to lead with the community knowledge, like you mentioned, Lili.
Yeah, jumping on that point, I feel like investors have a special privilege of ensuring responsible design upstream. And I thankfully have had the ability to ask those questions about the inclusion of Latin populations in user interface testing. There's even a wonderful company out in the market, AskMay, led by a Latina who went through Techstars, who is enabling a quicker, faster way of doing user interface testing so it's not so difficult to include Latin populations in your user interface upstream. Frankly, this is the benefit of having more Latinos in the investor world, is so that the kinds of products that come into market actually have somebody who cares that we're included in the design of the product. So from my perspective, you can have both impact and margins.
Yeah, I just want to take that point and continue it, where it's like, I think that touches on like the tension that comes up a lot when folks are talking about equitable design, which is like, we want the best talent, or we want to make sure that we're being profitable. And I think that really touches on the fact that like any equitable design framework or development process does not exist in a silo. Like we need to have like a fulsome organizational approach to this. And what comes to mind for me is that within 3 domains. One is making sure that we're investing in diverse teams that reflect the population. You really need to have that recruitment process that's investing in lived experience and bringing that into your organization. Second is building that sort of equitable product design framework into your systems and into your product development process that includes feedback loops, because there's no perfect framework out there. So you need to have communication channels that's connected with communities for them to give you feedback on whether that's working or not. And then the third part is really fostering an inclusive culture that enables people to bring their lived experience into your organization and actually have that lived experience translate into the decision-making across the board that ends up influencing your product features, what's prioritized over another. And I'll just call out some resources if folks want to get started in this space. When it comes to representation and culture pieces or culture work, I think the ACT report is a really great place to start. That's put out by the Tech Accountability Coalition. Very fulsome document, very long document, but you can kind of go to the sections that you need to or that you're looking to have answered. And then when it comes to equitable product design, I think some really great resources are one, Rock Health has some great resources around equitable product design and digital health specifically. The Google Health Equity team has put out some great resources as well. And I believe there's a new publication from NCQA that they recently put out around a digital health equity framework as well. And from those frameworks, some key themes that really come out to me is the fact that they're really highlighting the importance of incorporating historical and social contextual analysis in the decision-making around product development, and then also creating structurally embedded aspects of co-designing solutions. And that's where those feedback loops really come into play, where you're actually talking with the community to be able to co-design and shape what your product features look like.
Wonderful. I think you already started highlighting the emerging exemplars, but are there others that you see showing promising design that's impacting our Latine population? And just to be a little provocative, that can come from a Latine founder or not, someone that's including us in their build.
I think this is an interesting one. I would say I don't have a specific example of a specific company, but of a technology, yes. So as you know, everyone is, when we talk about the AI, it's like, oh, this GPT-4 is providing all this and people are building on top of it. Well, the GPT ones, the GLP ones are the ones that are going to outperform the GPT-4s. As we think about this technology that, you all probably are more familiar as from a health background, the semaglutide. I've seen it in the way my mom has been able to improve her health through Ozempic, right? And I'm actually I'm curious to see more of these types of innovations that will be coming from these R&Ds and helping lowering the cost. So then that way it becomes more accessible. And I specifically, this one, to me, is really interesting because as Felix mentioned earlier, like with the access to healthy foods, access to being able to have green spaces to walk, being able to have, these types of design of cities and communities. When we take a look at, the redlining history of where some of the zip codes that had some of that and some of the ones that didn't, of course, we see how communities of color were segregated, underinvested, and we have these, consequences that have been passed on through generations that now we have an opportunity to pretty much address in a way that through science and technology. And of course, through this, I'm not proposing that, I'm just sharing as an example of a science that when it's widely adopted, can start to change behaviors. People are going to start to change where they eat, where they buy, how they walk. So when we start to think about these larger behavior patterns of changes that can help enable, folks who maybe didn't have that opportunity or the mind space or just even that health, the physical health to be able to partake in these areas, especially when I think about, the over indexing of the Latino population. And I think about the kids in school, right? Of like how some of these areas could be more preventative when there are some of these behavioral changes, but without losing your culture, right? I think that's the other part that we want to make sure that we're addressing and it's part of it. But to me, that's an example of like, wow, what are the different, if that's an example, what's more to come? What are those, flywheel effects that we're going to have downstream? And are those further opportunities, for even for our communities to help innovate and help address some of those changes?
I'll mention two brief examples real quick. Vanessa, first thinking about the point that innovation doesn't always have to come from Latinos to serve the Latino community, but they better engage other stakeholders around the innovation table to make sure that everything is delivered in a culturally and just in a culturally relevant way, so people are actually engaging with the product, so it's successful, right? And so I'll mention Yumlish, for example. We have not invested in the company, but think really highly of Shireen and how she's leveraged non-dilutive funding, SBIR funding, to get us some real proof on how her program and model actually works by delivering text-based communication when it comes to a diabetes prevention program, right? So I'll give her a shout out. And think about another Latina that I think really highly of in Yvonne Rodriguez at Egality Sciences, where she's going out to the community and bringing her 20 years of pharma experience and knowing how to recruit for large clinical trials, and starting first by leveraging promotoras to make sure everybody knows what research actually is. It's a big, scary topic sometimes in our community, but building that trust requires boots on the ground work. And I'll give Yvonne props because she definitely does a lot of boots on the ground work, and matches that with technology that can be helpful to some of the stakeholders that care about faster recruitment and faster time to insights on that research.
Yeah, so I'll add, I've already mentioned Zocalo does a great job in communicating with the community. I would think that another example is Folks Health. I think they're a really great example of how there's a need for intersectional solutions, recognizing that there is a Latina, queer, and trans population that needs to see themselves fully in digital health solutions. That's something that really comes to mind for me, of like, how intersectional are folks thinking about it? How deeply are they thinking about our community and the needs that are in there? And how much are we actually centering those who are historically on the margins as well? The next example, I'll say I'm biased by being at Doximity, but as we think about those feedback loops and how that plays into product features that are actually prioritized with digital health solutions, at Doximity, we have a Dialer for Free Clinics program where we offer our telehealth solution for free to free clinics. And through that program, we have received feedback historically around expanding language access, which is something that we did, and we expanded to 6 additional languages on our platform in a way that is a simple process for patients to receive a message in the language that's set on the settings in their phone. So they don't have to choose a language. They receive it in the language that they already opted into that's on their phone. The other thing that has come from there is adding in additional spots to create space for group medical visits, because we already know that our community is very community first and family first when it comes to their care, their health care as well. So having that effect and influence our product has been incredibly helpful, not just for those free clinics that needed those solutions, but it's been beneficial to our enterprise clients and every other client that uses those telehealth solutions. And I think that's a really good example of utilizing those feedback loops and connecting with the community, and also the curb cut effect, in which how designing for a particular community can actually have broad effects for everyone who uses that solution as well.
You guys named all of the companies I love as well. I will say, broadly speaking, I'm seeing amazing innovation in senior care, in child care, in mental health, and in workforce. Specifically in the senior care markets, focusing on how Latina caregivers are playing an increasing role in the home. In the child care market, companies like Hazel Health that are focusing on Latino mental health needs in schools. Mental health, again, Centerai has done a great job, but an increasing connection across how mental health impacts lots of areas, including obesity, including substance use disorder, and responsible design can cut across all of these needs. And finally, in the aspect of the workforce, shout out to Care Academy, who is focused on making sure that home caregivers have access to skill building in Spanish as well right away, and also skill building to communities to reinforce their efforts. Thank you all for joining today's conversation around how we catalyze wellness in the Latina community. This is just one of many virtual series discussions and a flavor of the kind of conversation you will have at this year's Rock Health Summit. Thank you so much for joining.